look to the connection of the PulsioFlex and the PiCCO module. Below that we find the LUN connection. The LUN connection can be used for patient data management systems. The other two are USB connection, which can be used for internal storage of information of your patient. The PiCCO module on this side has three connections here. The first one, the orange one, is for your cardiac output connection. The cable with cardiac output and with the injectate sensor will enter here. The red one here is for your arterial pressure. Here you can put in your arterial pressure connection of transducer. The bottom you can see here is for your central venous pressure. On both sides we have also an extra connection. This is an output connection. This connection is to slave your arterial pressure to your external monitor of your bedside. That's the same what's for your central venous pressure. The central venous pressure can also be connected to your bedside monitor. This is your cardiac output cable. This is the orange plug. And if you look at your module, you can see the orange connection, so it's color coded. To connect it, just find the right spot, just twist and push it in. We have also the injectate cable. The injectate cable does not go into the PulsioFlex module, it goes into the connection of the cardiac output block. As you can see here, color coded again, this needs to be plugged in over here. Just easily put it in, push it through, and it's there. This is your arterial pressure cable. This one goes to your arterial pressure transducer, and this one goes into your PulsioFlex module. Just the same as the other connection, it's color coded red. Just twist and push it in, and it's set. After entering the power cord at the back side of the PulsioFlex, you just need to switch on the device by just pressing the button. When you turn the unit, you will see that there will be a green light. This means there is power on the device. When you touch the on/off button, the unit will start up. It will probably take about 40 seconds before the unit is completely started up. In this next video, we will talk about the disposables which are available in the United States. There are 5 different types of catheters. The 5 types of catheters are the femoral 5 French, length 20 centimeters, the brachial 4 French, length 22 centimeters, the brachial 4 French, length 16 centimeters, axillary 4 French, length 8 centimeters, pediatric catheter 3 French, length 7 centimeters. The PiCCO catheters are normally packed in a box of 5. On the labeling on this side, you can find the product number, PV201. After it, you will read 5L20. This means this is a 5 French catheter, length 20 centimeters. This is the femoral catheter. The expiring date of the PiCCO is 5 years. Just hold the lip over here and just pull it off. Or do it this way. Please note that the purpose of this demonstration is only to show you what's inside of this box. The physician can only be doing this in a sterile environment. Inside the package you can find a guide wire. This guide wire is a nitinol guide wire which doesn't kink when inserting and using it. We have 2 types of needles. One is for normal patients, and we have an extra length for obese patients. At the bottom of the package you will find the dilator. Then in the tubing you can find the PiCCO catheter. We specially place it in the tubing to prevent any damage. The whole technique will be used with the Selminger technique. The physician knows how this works. When the pressure transducer is properly flushed by a doctor or by a nurse, we can connect it to the PiCCO catheter. And this one, in our example, is being placed in the left femoral part of this patient. You can see the PiCCO catheter, and you see here the connection. This is the lower lock connection. We just simply connect this one to the lower lock over there, slide it over, just twist it clockwise, and it's set. Then we have an extra connection here. This is the blood temperature connection. This blood temperature connection needs to be connected to the PiCCO temperature cable, as you can see over here. Just simply put it together, twist it, and put it in. Just twist the lock, and it's set. Just a few extra reminders. The PiCCO catheter can be placed in the patient for 10 days. All the PiCCO disposables are single use. Besides the PiCCO catheter, you also need a monitoring kit. This monitoring kit provides you with an arterial pressure transducer and a central venous pressure transducer. Including in this kit, there's an injectate sensor housing. When opening the box, you will find the right items inside. Here you can find the two pressure transducer, which can be connected to the PiCCO catheter and the central venous line. Separately sealed is the injectate sensor housing. You will need this for the connection to the central venous pressure line. This is the correct cable which goes to the entrance of the AP and the CVP on the PiCCO module. The other end we have here where we connect it to the pressure transducer. So just take this connection, take the one from the pressure transducer and connect it like this. Of course you need an extra one, so there's always two cables going to the PiCCO module. Take this one, same as the other one, connect it like this, and it's set. This next video will show you how the pressure transducer and the central venous pressure transducer will be connected to your patient. This will normally be done by a doctor or by a nurse. Let's start with the arterial pressure transducer. When the pressure transducer is properly flushed by a doctor or by a nurse, we can connect it to the PiCCO catheter. The next step will be the central venous pressure. We're going to connect it to a central venous pressure catheter being placed by a doctor. In this example, we're going to use a 3-lumen catheter. After flushing the system, we're going to connect this one to the distal lumen of the catheter. So we're going to remove the blue cap here, take out this one and place it on the right part here. The next thing you need is a temperature injectate sensor housing. Just place it simply on this part. So take off the blue cap here and place the temperature sensor housing here and connect it clockwise, gently. Place your blue cap at the end of the temperature sensor housing, like this. What you need to do right now is take the temperature cable from the PiCCO and place it on the temperature sensor housing. There is a small pin over there. Just make sure it's positioned well and just firmly click it together. The last thing you need is a prepared cold syringe with C-line. You will place this one where the blue cap is. Take off the blue cap, place the syringe and connect it clockwise, like this. Now you're ready to make an injection. To give you a tip, just hold this one between your hand and your two fingers. If you do it like this, you can make an injection very easily without even having too much force for it. The central venous catheter can be normally placed for 3 days. So when you change the central venous pressure line, also replace the injection temperature sensor housing. This is the complete setup for the PiCCO. Now you're ready and set to make a PiCCO measurement. You have the central line on the top, the PiCCO catheter in the femoral part, and everything is flushed and ready.